Hey, Crystal, good afternoon. Good to see you again. Thanks for coming back to see us today for what I think is today a regularly scheduled 5-month post-op visit. What you had done was what we call a deep plane face and neck lift with, sometimes I refer to this as a minimal incision brow repositioning surgery. We thought it might be helpful to lots of people, maybe some of your Facebook friends on your page, but also just anybody that's checking us out on YouTube, etc. If we carried on another one of these conversations, tell us, how did you hear about me or us, or hear about this practice? And tell us also what in the beginning, that day that we met, what brought you to see me? What was bugging you? What did you tell me or point out to me that you wanted me to try to help you with?
Yeah, so I knew that I wanted to get something done to the face and that there's a lot of specialized nerves and so forth. And I wanted someone that specialized just in facial plastic surgery. So that's what I Googled for, is certified facial plastic surgeons in this area. And that's how I found you. And when I came in, I had, over the past 3-ish years, lost about 110 pounds, and my whole face just fell, and including the neck. And so my biggest concern was how much my neck was kind of dragging down, and then also that this here had fallen. And then I was also interested in hearing about maybe the eyes and the brow and lifting that as well. But those were my two biggest concerns, were the lower face and how it had fallen after weight loss.
Perfect. Okay. And so the next question I would pose to you now in this post-op setting is, tell us and the audience kind of what your perception of what I said at the consult and what I said we would do, and then how you feel about your results here sitting at the 5-month post-op visit.
Yeah. So I did 5 consults.
Whoa,
and you were my
okay.
first one.
Oh, really? Okay.
And I, right away, my husband and I both, because he was at all my
I
consultations,
remember
were
him
like,
being here that day.
we really like him. He seems like he knows what he's talking about. I kind of wanted to book my surgery that day, but I had 4 other consults to go to. But I will say, out of everyone I saw, your consult was the most thorough. And I had the most ability to ask you questions that got answered in depth in a way that I could understand. I felt like you were really knowledgeable about everything with the face. I was thinking I wanted deep plane, and that's what you were recommending. And so the fact that I could also ask questions, I did meet with some surgeons who said they only allow questions at your pre-op appointment. And so I'm a very research focused person, and I came in with a list of questions. You answered every single one of them. It never felt like you were impatient with me or that it was annoying to you on any level. And I just felt warmth, expertise. Sounds maybe weird to say humanness and kindness. I think that that's not all the time what we're looking for in a consult, is we want just the technical expertise. But for me, knowing also that you're just a kind person with the technical expertise is what made me want to book right away. And yet I knew I had those other consults on the book, so I wanted to make sure to do my due diligence. But after all of the surgeons that I met with, it was very clear that you had the most technical expertise and that I would feel the most comfortable with you and the whole staff, really, that were very kind, very welcoming.
Okay, thank you.
Yeah.
Here's a next big picture question that patients want to hear about. They want great results, and you can look at people's before and after pictures. There's, how many websites are there?
Yeah.
And one of the things that I try to tell people that you should always do is you should meet a surgeon, so that you kind of figure out if you vibe with them and they feel like personality wise, human nature wise, that it's a good fit. And you want to look at before and after pictures, because you can meet a nice guy, and there's some nice guys or gals, and then you'll go to some websites and they might not have, it's not that they don't have great before and afters, they might not have any before and afters at all.
Right.
But I think that's what you want to do, is you want to meet a person and see their before and afters. And those are the 2 biggies. But there's one other biggie in my mind, and that is not just the personality and the before and afters, but the patient experience.
Mm-hmm.
And so that's what I want you to talk about a little bit. And so what I mean by that is, I mean the real perioperative. And I'm using doctor words now, but perioperative, we usually feel like that means the before and the during and the after. And so you can kind of start from whenever you want with the preoperative experience. As you of course know, I have a clearance process where I
Mm-hmm.
want, above everything else, even results, safety first.
Yep.
So we have a clearance process where you have your primary doctor sign a letter of clearance, and we do EKG and some labs. But then, the rest of the pre-op includes the day of surgery,
Mm-hmm.
when I meet you beforehand and I pause and I say, hey, do you have any last minute questions? We talked about that. Do you have anything that came to your mind just today? So just share a little bit about what we would call perioperative process, the before, during, and after in your experience.
Yeah, I mean, from start to today, everything has been so wonderful. I actually look forward to coming here because everyone is so welcoming and warm. And even the way that pre-op, I had an appointment with Kate for her to teach me how to use all of the things on my skin, both because there's stuff for your skin for before surgery and after surgery. She taught me how to use all the things, when to apply them in my routine. And you called me on the phone after surgery. I remember the day of just feeling like I made the right choice because you were in there marking me up and said, I just love anatomy so much. And I thought, this is the right person because you clearly love what you do. And that makes me feel at ease to know that as well. And everyone from the anesthesia team to the nurses, everyone that day was so nice and welcoming and just made me feel really at ease. And then even the calls after surgery to just check in on me felt so nice to just even do that, and the level of care. And then when I could wear makeup, Kate taught me how to do cover up and cover the bruises that were still lingering. There's just been so much kinds of help that I didn't expect, kinds of teaching that I didn't expect. And also, no matter what appointment it is, you welcome every question that I have and take all the time to answer them. And so just the whole process, I couldn't be happier with the care, the expertise, and just the overall kindness that I have received here from everyone. Yeah.
Two other things I want to cover in this this interview of you. And I'll get them out there and then we can address them individually. One of them was, I want to cover discomfort. Notice I don't even say the word pain. I want to cover discomfort, and I want to cover kind of what you felt like is your downtime, because you're a young, pretty, but busy working businesswoman.
I am.
And so I think you're a great example. This interview is a great example to women out there who might be in their late 30s, early 40s, early 50s, somewhere in that range. And they might be thinking to themselves, well, God, I wish I could go ahead and do this, but maybe I don't have time to do this right now. I'm a busy career woman, or, or a busy mom, or both, And so, so I'll back up and let's address discomfort first. I'll just let you comment on that.
Yeah, so I am very busy working. I own 2 businesses and I have a child and 3 dogs. So I'm very busy, but I love that you use the word discomfort, because in my mind, there was never any pain. The worst thing for me was a headache. And that as soon as the clips came out, that went away. So, I mean, really it was just alternating Tylenol and ibuprofen for headache.
Do you think you took one or a few or none of the pain pills I prescribed?
Maybe just that first day, and that was it. And but even that wasn't anything where I was in a lot of pain. It was just a little bit of discomfort, as you said. And I felt great. Like there's no pain up here, but from neck down, I felt like I could do anything. And now, of course, you told me not to do anything, and I didn't. And I listened to your orders because physically I felt great. I had a lot of energy. I felt like I could do anything. I just knew that I had to rest.
That's right.
And so I think that as far as recovery though, I
Right.
mean, I was out and about to dinner with makeup on at about 3 weeks
Okay.
post-op, and by
Mhm.
6 weeks wasn't even wearing makeup out
Yeah.
and just,
Good.
going about
Okay.
my daily life like normal.
3 weeks out to dinner.
Yeah, with
That
makeup
right.
on,
That's
but
cool.
yeah.
I tend to say, okay, 1 week you're going to be bruised and swollen. At 2 weeks, maybe you can kind of get out and go to the grocery store. Maybe you want to have a hat on at that point or
Yeah.
something. But then 3 weeks, you were socializing.
Oh yeah.
Yeah.
Yep, I
What
was.
about in that first week? Did you feel kind of clear-headed enough maybe to be on the computer? If you were wanting to do emailing or something, at what day would you say you kind of might have felt comfortable if you were, say, an accountant or something and needed to look
Yeah.
at a spreadsheet or
Yeah, I mean, now my eyes from the upper bleph were a
right?
little bit dry, so
Uh huh.
at first, no longer.
Right.
So that just would have caused maybe for
Yeah.
that first week or so where my eyes would get a little more tired quicker
Yeah.
than they normally would looking at a
Yep. That's a
screen.
common symptom.
But I was replying to DMs from my customers that
Yeah.
first week, even though,
Yeah.
I'm
There you
just laying
go.
in bed. So
That's right. There you
so
go.
I was
So
able
functional.
to.
Right. Right.
Yes,
Yeah.
yes,
Good.
yeah.
Tell us how you've viewed the Facebook Facelift support page that you participate in. I think you said you didn't find me on it,
Mm-mm.
but then you have been, you've talked about me on the Facebook page.
Mm-hmm.
How do you feel like that's helped other people? Maybe is a good way to put it.
Yeah, so it's a wonderful place for people that are kind of along the journey as
Yeah.
you are. And some of us even formed a little group chat that we were all December
Yeah.
surgeries. So we
Okay.
kind of were in the same timeline.
Cool.
But it's a good place to just get support of, is this normal
Yeah.
after surgery? Is it normal to feel this way? Is it the numbness?
Right.
So people just reaching out with a lot of, is this normal in this stage of healing?
Mhm.
But also a lot of, does anybody have any recommendations for a good facial plastic surgeon that is not charging six figures for a facelift?
Right.
And there's a lot of people out there that are looking for a good surgeon that has the expertise, but also, like I said, it's not ridiculously
Yeah.
expensive. And so it's a place where a lot of people compare surgeons and locations of the
Mhm.
country and how much
Sure.
it costs here and there. And
Yep.
so anytime anybody asked for recommendations, said they were willing to travel or are
Yeah.
in this part of the
Yep.
country, I was quick to be like, here you go.
Mhm.
This doctor is fantastic and you get great results. I'm so, so, so thrilled with my results.
Cool.
I think that it was even week 1 that I asked you if you were a magician with my incision lines,
Right.
because I even at the ear, you could barely see anything and everything's so hidden in the hairline
Right.
that I was just so impressed with how everything looked even 1 week out.
Yeah.
And now 5 months out, I feel like I look like me,
Yeah. You should.
but refreshed.
Yeah.
I had my annual appointment with one of my doctors a few weeks ago, and she
Yeah.
looked and she's like, "You had a facelift 4 months ago,
Yeah.
but where's all the scars? And you look
Aw.
like yourself."
Yeah.
And
Yeah.
that's what I wanted, was
That's right.
for just to look natural,
Yep.
but to just look like a slightly younger version of
There you
me,
go.
not where someone could tell right away, oh, she's been pulled and
Right.
tight and
Right.
all of that.
Right.
And so I couldn't be more happy with
Perfect.
my results.
Very good. Okay. I think that wraps things up.
All right.
Thank you again. Thank you so
Yeah,
much.
thank you. Thank you.
Of course.
Yes.
Okay.